Welcome. This is Mental Health Matters. One of the most common questions I and my colleagues get asked is, so you're a psychologist or a psychiatrist? What exactly is the difference between the two? I think one of them can prescribe medication and the other one can't, so which one are you? The truth is that there are several other types of mental health professionals as well. In this installment, I will talk about 5 disciplines within the broader field of mental health treatment, including their similarities and differences from each other. The disciplines I will discuss are psychiatry, psychology, clinical social work, marriage and family therapy, and mental health counseling, which is also known as professional counseling. A psychiatrist is a physician, a medical doctor, whose expertise is in the diagnosis and treatment of mental disorders. They generally understand mental disorders as resulting from a combination of biological, psychological, and social factors, but they may place a greater focus on the biological components of mental illness. Psychiatrists treat these conditions with medications, which are chemical compounds that are designed to modify brain functioning and bring relief of symptoms that are being experienced by the individual with the disorder. There was a time when the standard training of psychiatrists included training in providing psychotherapy or talk therapy as well. In fact, there was a time when psychiatrists were the only ones who were licensed to provide that type of therapy. Nowadays, however, few psychiatrists actually and actively treat with psychotherapy. Psychologists, also called clinical psychologists or counseling psychologists, will have a doctorate degree, either a PhD or a PsyD, in clinical or counseling psychology. Both types will have extensive training in the science of human psychology, in diagnosing and treating disorders, and in providing psychotherapy and conducting psychological testing. In fact, psychologists are the only mental health professionals that are routinely trained to perform psychological testing. There is quite a bit of a variety when it comes to the various theories that psychologists use to understand human psychology and human behavior, but they often focus on a combination of biological, psychological, and social factors to understand how people's functioning is influenced. Clinical social workers hold a master's degree in social work and have completed additional extensive training in providing psychotherapy and in diagnosing mental disorders to individuals with a wide range of psychological and social challenges. The focus of social work is to enhance the well-being of people, particularly of those who are most in need or disadvantaged. Their training emphasizes connecting their clients with a variety of available resources, empowering people to overcome their challenges, and advocating for those who are unable to advocate for themselves. Marriage and family therapists hold a master's degree in marriage and family therapy. As their title sounds, their training focuses more on understanding how family relationships are built and what changes can help repair or strengthen those relationships. They help people work through troubled relationships between family members and focus less on the diagnosis and treatment of mental disorders. They are more likely to provide couple therapy and family therapy, although they can often successfully work with individuals as well. Mental health counselors, also known as professional counselors, hold a master's degree in counseling or in mental health counseling and are trained to provide a broad range of clinical services, including diagnosing mental disorders, providing psychotherapy, and crisis intervention. So to sum it all up, all of the above professionals receive years of training, including thousands of hours of practical experience, before they can obtain a license to practice independently. Any of the above can specialize in a specific diagnosis or problem or specific population with appropriate training. While there are differences between them, there is also a considerable amount of overlap in the services that they are competent to provide. The particular degree that a mental health professional has is often not the best indicator of their quality and effectiveness as a clinician. It is always advisable to get recommendations and to ask questions that are important to you when deciding which professional to work with. Thank you again for watching today and for doing your part to fight the stigma of mental health problems. Stay tuned for future installments of Mental Health Matters for accurate and reliable information about a broad range of mental health topics. Your feedback, questions, and comments is always welcome and can be submitted to me via drdbrownstein.com or on Facebook at facebook.com/drdbrownstein or at drdbrownstein on Twitter. Remember, mental health matters.